ran against Jim Brown-waite. Of course, he lost, but he put up a valiant effort. But one thing I want to say, he is what we need. He's what Mr. Obama needs, because he said that he wants some drum majors for health reform. And I can say that Mr. John Russell, has been a drum major for health for a long time now. So as I call you forward, please give up a hand. Mr. John Russell, please come forward. Don't fall over yourself.
Okay, thanks a lot. I appreciate the opportunity to be here today, and we've been here quite a few times now, going over the years. You know, I listened to President Obama's speech to the American Medical Association the other day, and I was heartened to hear what he had to say, because, you know, I've been working on this issue for the past 6 years, and there were certain things I wanted to hear from President Obama. We are in much better shape, all underlined, than we ever would be had the opposition been successful against President Obama and Joe Biden. President Obama talked about making sure that everyone has access to quality, affordable health care, no matter your economic circumstance, no matter your station in life. We're going to make sure that everyone who lives here in this country is able to live as healthy a life and as long a life as possible. That's what I've been seeking over the past 6 years. There are tremendous obstacles that stand in the way of this happening. When Abraham Lincoln signed the Emancipation Proclamation, he was restoring the soul of a nation. When President Obama signs a bill ensuring that health care, signs into law a bill that ensures all Americans access to quality, affordable health care, then he will once again be acting to restore the soul of a nation. For what is a nation that doesn't seek to take care of the people who are the least among us? But today it's not just the least among us. It's the people in the middle. It's the people who are losing their jobs, who once thought their futures secure. It is true that 50% of all the bankruptcies, actually it's 62% of all bankruptcies, have a major medical cost component as part of it. And of those 62%, 76% of those people had health insurance when their bankruptcy and their financial integrity began to be called into question. Now, as you know, I work in healthcare. And in my work in healthcare, I hear and see the actual things happening. When I talk to the case managers who go around and check on everybody's insurance and so on and so forth when they're in the hospital, the case managers tell me that more and more and more people are what we call self-payers, people who don't have insurance. Now, when I was in a debate the other day on the Kathy Fountain Show with a neurosurgeon, David McCallum, and Professor Wolfson from University of South Florida, it was really, I'm the guy who's for Obama's plan, and of course we have the three of them against us. But I made some very important points. And, certainly one of the points that we have to look at is, what is it that is causing all this angst among the politicians in Washington? What is this powerful force that's arrayed against us, against Americans having access to health care like, we'll say, 36 other countries do better than we do on the World Health Organization list as far as performance in health care? Well, it's one thing. It's the lobbyist checkbook. The lobbyist checkbook is that weapon that's being used against President Obama and all the rest of us who seek nothing more than to live long and healthy lives. I have some personal experience with this. In 2006, when I was a candidate for Congress here in District 5, I was approached by a Washington, D.C. consultant. And over several conversations, with the final conversation being, John, if you're willing to play ball, if you're willing to work with the pharmaceutical industry, we can get you all the contributions you need. Well, of course, I turned that down. Now, a lot of people in Washington don't turn that down. In fact, if you got to Washington, there's probably a good chance you've made some major compromises. We see that with Max Baucus, chairman of the Finance Committee. Now, Steve Zeldon's handing out sheets, lists of these people who are on the Senate Finance Committee who we should be talking to by calling their office and emailing them. Well, are they going to respond to that? Max Baucus was for a public option before he was against it. And when we talk about Ken Conrad, his plan is nothing more than a political compromise to move away from, doing what's right. Now, it is important for us to be involved. We can cheer President Obama all we want, but Steve Zeldon said earlier again, President Obama needs us to support him. If he doesn't get the support from the public, because we don't have these $2,500 checks to be sending to certain people. I mean, does anybody here think, Bill Nelson is going to respond to this? Bill Nelson is one of those people on the Finance Committee, a Democrat, who is not supportive of moving in a direction that we want to go. When we look at where we are and where we want to go, there is a tremendous gulf that divides the people from the people who are representing supposedly our interest in Washington. And I want you to look at the fact that just because someone has a D after their name, and when I mention Max Baucus, when I mention Ken Conrad, Debbie Stabenow, these people are standing shoulder to shoulder with the insurance and medical industrial complex in this country, standing against what is the only objective solution to our problem with health care, which is fundamental to curing our woes with our economy. Employer-based health care is going away. It's too expensive. The insurance industry has been roundly inefficient. They're fat, and they want to stay that way. And so it's up to us, folks. I was on the phone to Nelson's office the other day. I called these people. You have the list, you call them, and that's the best we can do. And then you say, President Obama, if we support you, you will then support us. I support President Obama. His policy is right, but there's all kinds of people out there working for those checks to make sure that things stay exactly the way they are. I'm John Russell. I'm going to be standing for you in healthcare, speaking in various forums and so on, debating people on the other side like Dr. McCallum, Professor Wolfson. I'm going to make sure that your voice is heard, but we need to hear, the politicians in Washington need to hear your voice through your phone calls and your emails. I thank you very much. I thank you for your support, and let's try and get this thing done. Thank you very much, and happy Juneteenth.
Okay, we've heard two cases of the health about health on the national level. we need to bring it a little closer